on. We've got we have an hour. It's a little shorter than usual, so we'll be moving fairly quickly, and I appreciate the presenters understanding that. But we have a lot of good information to share today. So let me put up the agenda one more time and we'll just kind of share it with you. So when Rep Ford gets here, we'll have a few words. We've asked Kathleen Monahan from Super, from the director of the opioid response effort there, to talk about the new and exciting drug overdose prevention program. Really hope that all organizations that are on here definitely check it out and hopefully enroll. And then our Lawndale Christian Health Center collaborators and friends are going to talk about their experience with direct service outreach in relationship to this great collaboration that's been making a big difference on the west side. Vana and Dr. Napier are going to talk about the Sentinel work group, give me an update on that and the training survey that was given out. Sandra Harrison is going to give us up to date on the Overdose Awareness Day, which is August 31st, which is a Tuesday. And then we have time for member updates and comments. I will stop the share. And has Rep Ford joined us? Yeah. It's not. So without further ado, Kathleen, I hope you're not shuffling papers. That we can start with you.
I'm right here, and if Rep Ford does join, feel free to interrupt my presentation.
Okay, well, yeah, we won't do that. But and also everyone, we have too many people really to do introductions. But please put your information in the chat. And if you have not necessarily been connected with us before and gotten emails directly, let us know, and we'll make sure we put you on the list. So welcome, Kathleen, and great to hear about this exciting program that's been rolled out within the last couple of weeks.
Hi, everyone. Yeah, I'm very excited about this program, Lee. It's been a long time coming. It takes quite a long time to get purchase orders like this through the state system. So everyone on the state side is very, very excited about it. We call the program Access Narcan. It is partially funded by the grant that I manage, which is the State Opioid Response Grant from SAMHSA. So that's why I'm giving you this presentation today. I work with all the people that you've ever met that work for Super. So $13 million has been set aside. Some of that is state opioid response funding and some of it is cannabis funding in order to create an open purchase order with the manufacturers of nasal Narcan. That company is now called Emergent. They used to be called Adapt Pharma. Some of you might recognize that name. And we are offering Narcan funded by the state to any organization that is already a DOP, any organization that is willing to become a DOP, and DOP stands for Drug Overdose Prevention Program. Sometimes I feel like with this group, I can use shorthand for everything. So apologies if I use an acronym too quickly. And for the first time, we're allowing hospitals and clinics also to purchase Narcan directly through this project. And it will get delivered to the emergency room. Previously, there's been a challenge for hospitals because they're not supposed to distribute medications. You all probably know all those details. So how does it work? The short process is right here on this screen. You go to this website. The easiest way to get to that website is to go to the main page of the Illinois Department of Human Services, scroll down to the very, very bottom, and you will see the words Access Narcan. It's a clickable link and it will bring you to the website. Once you're on that website, you're going to fill out a form that gives us information to enroll you in the drug overdose prevention program. It is very simple information, contact information, address, email, etc. Any community organization that hasn't already been registered as a drug overdose prevention program needs to download a copy of the state standing order for naloxone and upload that order into the SurveyMonkey. And the SurveyMonkey won't let you complete until you do that. And the SurveyMonkey takes you right to that page and takes you right back to the SurveyMonkey. So it's quite easy. And then you must sign it. And signing it is not an electronic signature. It's literally just typing your name in, but it means that you agree to do what we are asking the drug overdose prevention programs to do. And I'll get to that in a second. Once you submit your SurveyMonkey form, which is really just a form, you will receive a confirmation email from the drug overdose prevention program coordinator at DHS at Super, and it'll give you information about sharing some data with us when you start to distribute Narcan. Then and this all happens within a few days. It's not going to happen instantly. It's not an auto email that you're getting. Within a day or two, you will also receive an email directly from the manufacturers of Narcan, giving you login credentials to their website so that you can order directly from them and have it delivered directly to you. So the biggest point that I want to make today, and I'm going to show you a lot more in a second, is that you agree to share data into the drug overdose prevention program website, which is called IllinoisSavesOD.org. It's at the bottom there, ilsavesod.org. And many of you who are already drug overdose prevention programs know about this portal and that the information we request is not onerous. Who did you give the Narcan to? Did you do any trainings? Are you aware of any overdose reversals from the Narcan that you've distributed? So let me show you what the landing page looks like. There are two big buttons in the middle of the page. One is for hospitals and clinics only. They have a different process. And one is for community organizations, such as I think almost everyone on this call. And once you are on this page and click on that document, you'll be in the SurveyMonkey. I urge everyone on this call to keep this website very, very handy, because if you scroll down further, and I'm not going to go into it right now, we have copious educational and training materials for you. PowerPoints, PDFs, training videos from SAMHSA, from Super, and those are all available to you on this website. So once you click on the Access Narcan button for community organizations, you will be brought to this page. It's the introductory page for the form that you will be filling out. And this paragraph tells you basically what a drug overdose prevention program is asked to do once you enroll in this program to get the Narcan that's funded by the state of Illinois. And just as a reminder, that important statement at the bottom, it will not be a complete application until you agree to do this and until you sign and date it on the final page of the SurveyMonkey form. For those of you who aren't familiar with it, this is what the page looks like to download a copy of the standing prescription order for naloxone in the state. Again, it is a fairly simple, user-friendly website. You answer a few questions. At the end, you agree to be shown on the Illinois helpline. And then you download a copy of the standing order and you upload it into the SurveyMonkey form. And then you sign and date the form. So I'm going to go over it again. You agree to become a drug overdose prevention program. You agree to submit some data, not onerous amount of data, into our portal at IllinoisSavesOD.org. You upload the standing order into the SurveyMonkey, you sign and date it. We can't continue the process and give organizations a login to the Narcan page unless you fully and completely fill out the SurveyMonkey form. So as I said at the very beginning, two things will happen once you submit it. You're going to be sent a login and credentials directly from the manufacturers of Narcan, Emergent. And once you have that, you will place an order directly with the firm. Your order will be paid for by the state of Illinois. You will separately receive information directly from the Drug Overdose Prevention Program Coordinator at Super with follow-up instructions about how to input your data into the Illinois Saves OD website. We ask for this data because it's required by the federal funders, by SAMHSA. Anyone on this call who's an existing drug overdose prevention program, you should have received an email from Emergent, the manufacturers of Narcan. If you have not, or if it went to your junk page, or if you think you are a drug overdose prevention program, but you're not sure, any questions at all, contact me and I'll be happy to confirm your enrollment in the DOT program and get you your login credentials. So how do you get the actual Narcan? You log in with your credentials, you create an order. We suggest that the maximum order should be 10 cases to start with. One case is, I think it's 24 doses.
12 boxes, yeah.
12 boxes, 24 doses. 10 cases would be 240 doses. It will be approved by Super within, usually I approve it within a few hours, but I'm saying a few days because we might end up batching some of these orders eventually when they start coming more fast and furious. The Narcan will be shipped directly to the address that you have put on your order via 2-day FedEx. And I want to make this point really, really clear. You can reorder. You do not have to order a year's worth of Narcan or 6 months worth. Order what is going to be comfortable for your organization to receive and manage, and then feel free to reorder. This is a really large project. We do not anticipate the funding for this ending anytime soon. There's not a time limit on it right now. And so please go in and register and order your Narcan. Okay, we probably don't have time for questions, but I threw that in there anyway, Lee. I'm gonna stay on the call till the end in case people have questions. And there's my email address. Feel free to get in touch with me. Thanks.
I think there was, had their hand raised.
I didn't see any hands up. Let me double check.
I want to say that hand was raised just identifying that they did in fact have sign up for a DOP piece.
Okay. Well, thank you. And you know, this is a real exciting because, you know, each one of those boxes of two on retail would cost $75. And so this, you know, we've been trying to find ways, we as the task force and our partners to get this, and now it's available to us. Thank you very much, Kathleen, and a shout out to Kashfi Viveros, who worked from the emergent side of things. to pull this off. This is an amazing feat, and it's great. And as we bridge to the next presenter, it's from Lawndale. I just want to let you know why it's so important that we get more Narcan out there. If you had seen the latest mid-year report from CDPH about the opioid issue out there, there's some big wins out there. Just let you know that Humboldt Park and East Garfield Park, the opioid-related overdose EMS responses decreased by over 50% in the first 6 months of this year compared to last year. And two other communities, Austin had 191 less calls, and West Garfield Park had 50 less calls. That has a lot to do with the street outreach piece that's been going on, and all the collaboration, and all the folks that have been DOPPs all along the way. That's a huge win, and we need to continue to work on that and keep sustaining this. What that means to me is that folks are getting Narcan and they're taking care of their friends and family.
Hey there, Lee. Amanda Litt just said in the chat box that there's a couple more things she'd like to add, and do you mind?
Go ahead, Amanda.
Okay, great. Thank you so much, Lee. And thank you, Kathleen. That was a phenomenal presentation about the process. And just thank you so much for your partnership too. It's been a really great, easy process. I think for any of the folks that have already registered, hopefully it's been easy. But we stand here ready to help and guide anyone who's interested in becoming a DOPP provider on how to, access that Narcan Direct once they get their login. So we are here ready to partner with you all. Just one thing, Lee, to your point about what the retail cost would be, it would actually be like closer to $125. The $75 is the public interest price. So yeah, it would be even more than that. So it's pretty incredible. This program's amazing. The goal is to help gain access and to save lives. And we're just really grateful to be able to partner with Kathleen and her team at Super and others to make it happen. So I introduced myself in the task force call last week, but I am Amanda Lick. I am the new sort of, I'm covering and supporting the state of Illinois now, the new cash fee, but she's not gone. So I'm really grateful for that. And in addition to the educational materials that Kathleen discussed earlier, from the Narcan perspective, we are happy to help the DOP enrollees with providing demo kits. So if you have an event coming up, you need additional educational supplies like the actual kit, because we recommend that you do not use a Narcan that has the medication in it. We want to make sure that you're not doing that. So we have just the kits that have, air essentially, or water if you need to see how it sprays. Please reach out to me. I put my contact information in the chat, but it's really easy. I'll put it in again. And Kathleen has my information too. But I can order that and have it shipped directly to you. So we've got, trifold brochures and the pocket inserts. So happy to share all of that with you. We have stickers, magnets, whatever you need. Yeah, and then I guess just really quick, last but not least, oh, there was one more thing I was going to say. Anyways, I'll write it in the chat. I know we have limited time, but thank you so much.
Thank you. And so folks, you've got a couple portholes to get information, questions to. Use the task force if you have questions, and we'll route it to who needs it. But again, we really encourage any organization that's on the west side interacting with people, even businesses, they see things happen out in front of their businesses all the time. So no group is too big or too small to be a part of this. So, and thank you. So let's transition over to Lawndale Christian Health Centers. Katie Robinson and Josh have a presentation about what's been happening out on the street with Narcan and with the connection to treatment. So Katie, you're up.
Awesome. Thanks so much. Yeah, and thank you, Lee, for pointing to those statistics regarding the decrease in overdoses and EMS calls in those areas. We're definitely excited and humbled if this work is having impact on those numbers. Certainly based off the feedback of community members that we meet and discuss our work with, they've been very grateful for the Narcan distribution and find it very meaningful. So I don't know exactly how our work relates to those numbers, but I'm optimistic, so thankful for that.
Oh, I'm pretty sure.
So Lee, would you be able to pull up that PowerPoint slide?
Sure.
Awesome. Yeah, so big thanks to Lou and the Westside Heroin Task Force Outreach Team for welcoming us. I can say with all honesty, I learn something new every single day when I'm out with you guys. And that really impacts, you know, we turn around the information that we learn from community members and you guys to thinking about, as a clinic, how are we making our services more accessible based off of the information we're gleaning. So our hope being out there with the street outreach team is that we are able to offer same day referrals to treatment. That would be same day medication assisted treatment appointments at any of our Lawndale clinics on the west side, or same day access to a medical stabilization unit. We have medical providers over at St. Anthony's who are able to take in patients that we are meeting and discussing, you know, their desires either to go from St. Anthony's to inpatient treatment or stabilize on medication assisted treatment and then follow up outpatient with our clinic or another facility. So what that looks like, our workflow, the Lawndale RCC, that's Josh and I, we walk around with the street outreach team, or we're meeting folks at the booth that's set up. As the street outreach team works to offer Narcan distribution and training, we then follow up and say, are you interested in medication assisted treatment like Suboxone or methadone or Vivitrol? Are you interested in residential treatment, either for yourself or someone that you might know? We can offer resources. I'll show you our brochure in a moment, but if someone is interested in accessing that service same day, what we do is we set a med Uber ride either to clinic, where they would be set for a same day appointment with our substance use clinic, or we offer the med Uber over to St. Anthony's and do a warm handoff with the crisis worker there. We can also accompany those patients to their appointments or to St. Anthony's just to ensure better follow-up and linkage. If we've got a patient come in from the street outreach team to clinic, our goal is to have someone accompany, a support staff person accompany them through that first appointment and to the pharmacy to make sure their medication is picked up. Yeah, so Lee, would you pop to the next slide? We are carrying around these brochures, which hopefully we can distribute to you all after this meeting. This is our brochure for our substance use treatment options at Lawndale Christian Health Center. If someone is interested in treatment, but they've got something going on that day or the next day, we offer walk-in opportunities at our gallery space, which is the home of our recovery community. That address, 3824 West Ogden, is adjacent to our main clinic where our substance use clinic hours are housed. So that means a patient can walk in Monday through Friday, 9 to 5 p.m., request a same day appointment and be seen by a medical provider. Or get access to St. Anthony's from there, or I can work with them to provide referrals to other inpatient treatment options. Awesome, and I know Josh is on. Josh, are you there? I was
I'm here.
A story of success the other day. Also, I think I saw Gail on the line. I wanted to give her a shout out because I really like, we got this system where she meets first with the community member, kind of warms them up a little bit, and then waves me over and gives an excellent handoff to Lawndale. That just kind of helps bridge that gap, because we know medical care, there can be just a million barriers for the community members that we're meeting with to accessing that. And so I've really appreciated that collaboration. Yeah, Josh, take it away.
Okay. Yeah, just to reiterate what Katie said, we're really grateful to be able to work with the task force. And yeah, it's been surprisingly easy for a lot of patients to be handed off to talk to us, which I think is great. The task force members can bring up Narcan education first and then bring up possibility of treatment. A lot of people are very open to that, to discussing that, which is awesome. But we thought it would be nice to have one, just like a story of a recent patient. Turns out, can't remember who I was with that day, but it was kind of the first person we were talking to actually for that day. they asked her if she wanted Narcan, and she's like, actually, I just want treatment right away. Like, I want to go in today. I pulled her up in our system. Turns out she was an old patient of ours. She didn't even remember that. But that made everything a lot easier too, to have a chart already. And we were able to provide transportation directly to the MSU that day, the stabilization unit. And I was able to directly accompany her, made sure she got registered. The social worker came and grabbed her, and then we kind of followed up afterwards, checked the hospital portal system to see discharge plans. Turns out she's been following up at a methadone clinic as outpatient. We don't do methadone at Lawndale, but it was good to just see that she was doing long-term follow-up afterwards. And I think she even has an appointment with us within the next couple of days, just to see how she's doing. So yeah, excited to follow up and see how she's doing.
Awesome. Awesome story and awesome work. You know, this collaborative has been happening for about almost a year, a year and 4 months now, a year and 5 months. And we have other partners here that, you know, we've been working with, and this has been great. The whole concept of the warm handoff, a lot of times people think about it as, well, we're going to get them into, we're going to call a place and get them in, or we'll refer them by giving a flyer. But this is on the ground happening right now. As Katie was talking, Gail Richardson, one of our lead outreach team workers, basically just kind of says, well, I know somebody right over here that can help you, and just walks them right over. And I also do want to give a shout out to the folks at Haymarket who have been joined us, Thresholds, Greenbacks Health, Transforming Reentry Services, Healthcare Alternative Systems, the Triage Center, and other folks. And I hope I haven't left everybody out, but this is a partnership that really is making an impact. You can see that from the numbers. We learn from each other every day. Everybody does debriefs so that we can kind of process what's happened out there. And correct me if I'm wrong, everybody, there's some kind of natural leaders out there that are kind of stepping up, even though they're out there and maybe homeless or also having difficulty with their own use. They're very active in making sure that folks word that you're out there. Sometimes they'll even tell you, hey, you might want to go over and check out this area over here because they need you all. And so, and we have some folks kind of follow us around or know where we're going to be, and you know, go many blocks to rejoin you all. So, do we have some questions or any other comments? I didn't mean to take your thunder away. It's wonderful, Lawndale. And I saw you use Dr. Huggett's smiling face on that brochure. That's always good.
I'd love to respond to Ms. Carly Rose's comment. Yeah, that is, I think, points to something that's helpful about the street outreach. A lot of the conversations that I'm having with community members to the street outreach team is difficult conversations on the barriers that they've faced when trying to access treatment. So I will direct message you my work cell. I'll get you information on the gallery space where they can walk in, and we can give support and guidance on how to find a place that can support those infections so that they can be prepared to be received by a treatment center that might not be, not have the medical expertise that is needed from the get-go. So I'll reach out to you.
You know, another thing we could do is have a special call meeting, Zoom, where we just pull folks who are interested in learning more about how this process works. You know, when we're out there, maybe 2 to 3 times a week, that's one spot in, you know, a community of over 180,000 people. So the more folks that have this kind of concept and know how to do this, the better. So we can make changes across the website. Any of the outreach team want to weigh in? I know they're online here.
Hey, Lee.
Yes, Lou.
Right now, we're just laying back, listening and appreciating the information that's coming through. I just want to mention West Care is also one of the collaborators that's been out there with us. But we're just preparing, getting ready for our next outing and for the International Overdose Awareness Day. But we thank all of the resource groups for coming out and supporting us with this, because without them, this wouldn't be as successful as it is. So again, thanks. And I asked a couple of team members to speak, but they said not today.
Okay, well, they're saving it for the streets. So great. So let's transition and welcome Rep. Ford, if you wanted to say a couple words before we transition.
Absolutely. I should congratulate everyone on their passion and love for the cause. And I'm looking forward to International Day that we'll be celebrating on the West Side. And I do feel very strong and confident that you all are making a difference. We are making a difference together. It's just a blessing to be in this mission with you all. So thank you so very much. I would also say that when I talked to Lee and Lou, and I think I got them figured out which one is Lee and which one is Lou, I think. But both of them are very, very passionate. And we talk a lot, and they talk with much passion. And Lou, and he meant that I come out immediately to the Garfield Park, because there's a spot that people use drugs and they use needles. And in that spot is a lot of used needles. And it's been very, I think Lou has lost sleep over it, because he talks about it to me all the time, about how we have to do something about it. So I appreciate that. And what was most noticeable was that people knew Lou when he walked on the scene. And so when you have people that know you, that means that you're really doing something, and I appreciate that. One other charge that I would like to ask, if we can add some type of awareness for hepatitis to the cause, so that people are being tested for hepatitis, especially while we're out there. I think that there are people right now that may have hepatitis and may not be treated for it. So if we could raise awareness about hepatitis, that would be ideal. And with that, I really appreciate all of the work that we're doing together. Thank you, Lee.
Great. Thank you. And I'm glad you brought up the hepatitis piece, because I did leave out the Night Ministry, who's joined us many times, bringing first aid and support. CDPH has been out there. Cook County now has joined us. COIP has joined us as well. So there's folks out there, but what we know is the coverage isn't 24/7. Ideally, that's where we would be at. But we don't necessarily know who's out there when. And I think that's one of our next steps, is to really find out what the coverage is Monday through, throughout the whole week, so that we know who's doing what where, and then we can be aware of each other. So when you need those kind of warm handoffs, we know who's out there and who's giving out what kind of services. So.
And Lee, one last thing, if there's someone with the advice on how we could approach that hepatitis awareness while out there, I don't know, is Dr. Huggett, if the Lindale or anybody on, and I appreciate Lindale, because they are over there all the time walking the street, and they're looking to do more work over there. So thank you, Lindale. So is there any way that we can deal with the hepatitis issue, making sure that the awareness is there?
Rep. Ford, this is Dr. Haggett, Lundell Christian, and the group. Yes, absolutely. We need to make sure that people are screened for hepatitis C in particular, and HIV. Those are conditions that are very treatable, and hepatitis C is curable if we get it at the right stage. So I absolutely agree with you, Rep. Ford, that we need to make sure that when we make the connection for treatment for opioid use disorder, that we also are screening for hepatitis C and HIV and other conditions. Thank you.
Thank you, Dr. Huggett. Thank you, Lee.
All right, great, thanks. So I know we're moving fast here. So I'd like to introduce Fauna Hernandez and Dr. Celeste Napier for their presentation on the fentanyl work group, another important piece that we've been.
Mr. Rush, may I share a word? Thank you. Hello?
Sure. Yeah,
Yes, this is Willie Davis from Transforming Reentry Services.
Yeah, hey,
And
Willie.
I'm just glad to be a part of the West Side Outreach Prevention Partnership with Lou and his team. They do a great job out there. Also with West Care, Lawndale Community Health Center, and Threshold. We all provide an increment part that serve the people. And the people's really cling to us and they really want our services out there. And I want you to know that also we here at Transforming Reentry Services, we do HIV and hepatitis C testing. So when you when Representative Ford mentioned hepatitis C, my antennas went up because that's something that we can do as well. Maybe me and Lou, we can talk about it and maybe we could put together something where certain places that they go on the west side, we can do the testing. We could do the HIV and hepatitis C testing as well. Okay. So that's something that, we're interested in doing and we can do.
Great. I see Dr. Huggett. Oh no, that was Rep. Ford loved it. Well, he knows how to push those buttons. All right. So
also Lee, this is the first time I met you, Mr. Rush, and it was a pleasure to meet you. And also I want you to know we got an event coming up on August the 28th at the National H. Philip Randolph Pullman Museum on the south side of Chicago on the 28th from 12 to 4 p.m. And I'll send you a plugger, as we say back in the old days, send you a plugger, but I'll send you more information about our event for August the 28th. And I'd like to see Mr. Ford out there as well.
All right, we'll push that out there. Thank you.
Thank you.
Right. And I'm sitting here realizing that why we used to have 1.5-hour meetings, but go ahead, Vana. Welcome.
Hello, everybody, and thank you, Lee. Great information so far. So I'm going to try to be really quick. So I want to give an update on the fentanyl work group. And it's exciting because we've made some great progress, and I'm really thankful to everybody who has consistently joined the work group meetings. So there's 3 points, and every time we talk about the fentanyl work group, I'm going to bring up these 3 points because I don't want us to lose sight of what it is we're trying to do with this work group, what we're doing. We're not trying to do, we're actually doing it, which is really exciting. So the first one was education, which we're going to talk about today, and this would be education for providers. So around fentanyl, the fentanyl crisis, and understanding the drug and all of that, and additional training as well, education as well. The next thing that was on our list was funds for testing, to be able to test for fentanyl at the different facilities and detoxes, treatment centers, clinics. And there was guidance provided by SAMHSA on April 7th. I'm not sure if everyone got that, that stated federal grantees may now use funds to purchase fentanyl test strips. So I read the article and reread the guidance, and it sounds like all of our programs can, if you have federal funding, any program with federal funding can use those funds to buy fentanyl test strips. I would like some input from anyone who may have interpreted it differently, but that's progress, right? And then the final thing was for Super to provide us with guidance on how to deal with fentanyl in our facilities. So I have to say that Super has always been an incredible partner for us, and they just stepped it up. I was really amazed. The work group reached out to Director Jones. He responded really quickly. We had a meeting to discuss what it is that we were looking for from Super around guidance, and they got right back with it and sent out a smart alert. Hopefully all of you guys have seen that and seen the guidance that Super provided on fentanyl and testing and how to operate in our facilities and of course, reiterating that that drug testing shouldn't be the only thing that allows somebody to have access to treatment, right? We should be doing assessments and those kind of things. So if you haven't seen it, we'll be happy to send it out again through the task force. So really quickly, I want to also bring up, I'm going to share my screen and share the results of our needs assessment. All right, there we go. So I'm going to go through this really quickly, but first I'm going to ask Dr. Napier to do a quick overview on why we approached the education piece this way and what we hope to achieve. So Dr. Napier, you want to jump in here?
Sure, Lana, thank you so much. And again, I'm so honored to be a part of this important effort. I think as a biomedical preclinical researcher and an educator, I think this is really, really important. So basically what we wanted to do is to make sure before we actually launched an entire educational program that we made sure that we understood the communities that we're trying to reach out to and that we were able to meet their needs. And so we put together this needs assessment, and then we ran a pilot, sort of a proof of concept survey to see if we thought it was useful. And I think you'll be able to tell from what both Lana and I can report to you today that I think we're onto something that's very good, and we're going to be ready to move on to the next step.
Absolutely. So our hope is we had a smallish group of respondents. We'll be sending the survey out again after the meeting today to get more people. The more data, the better, right? And Dr. Napier will speak to that after we go through these slides. And my hope too is that once you see these results and with the topics, that you can take this to your organization. We can use this as a group as well. But it's really good information to let you know where people in our community, serving the people that we serve, are wanting to see in terms of training. So I'm just gonna let's go. So the first topic that we asked people about were modern prevention strategies. And you can see here, this was a moderate need for training. And as I said, Dr. Napier will break it down a little bit more. And we can send this out as well, so you'll have an idea of what the results were for each of the topics. The next topic was scientifically validated treatment protocols. And this again was a moderate need for training at 54%. The next one is scientifically validated recovery paradigms. There was a high need at 42 and then another 50% moderate need. So this is something that is really important to the people who took the survey. Diversity related prevention, treatment, and recovery. This is a moderate need at 60%, so really high. No one said there's no training needed in this area, so people definitely want this as well. So serving vulnerable populations, moderate need at 44% here. Optimizing healthy choices during recovery. This is a moderate need at 42%. Pharmacology of the various opioids, fentanyl, and its different analogs. So this is high and moderate need here as well. Methods to diminish stigma. This is moderate and high need at 36%. And engaging the family, 52%. And then we asked other topics of interest. So if there's something that wasn't included in the survey that people wanted to see, there were quite a few responses, which means that people are really, they were engaged in this process, and we're really grateful that they were telling us what it is that they wanted to see. So I included everything. I did not edit them at all. And so current community resources was a big one. Opioids and pregnancy. And we talked about this at the last work group. As all of you know, since Women's Treatment Center is closed, who's taking care of these women? I know that there are some programs out there that picked up some of them, but this is a topic of interest. Applying for grants, working with police, advocacy, which we talked about on this call today, street outreach. Let's see what this one was. Recovery housing, detox to abstinence programs. Some people said open to any training at all, medication management. Let's see, prevention and best practices trauma therapy. So those are some of the topics of interest. Again, we can send this out to the groups if you guys would like to see these results for yourself. And we will be sending the link for you guys to take the survey as well. I really do encourage you to go ahead and do that so we can have your input as to what we begin to educate our providers on, the providers that we work with. So I'm gonna.
Vaughn, I just plugged it in. I put that Survey Monkey link.
Great, thank you, Lee.
Chat,
You're so efficient. Thank you.
I also interrupt people. Sorry.
That's okay. That's all right. So Celeste, do you want to go ahead and talk about the bridge you put together, the scientific piece of the results here?
Sure, do my best. I'm going to try to share screen here. Let's see.
And just let you know, we're at 1:49 already. So.
Oh wow.
Right. So I need about 2 minutes. I think I'm good. Is it
Okay.
up?
Yes. Can see it. Yes.
You can see this?
Yes.
Okay, good. So what I did is just quickly put together a summary, sort of a take-home message, so that you guys can see how we will be using these data to then sort of construct a curriculum for health professionals. So first off, what I thought was really important was get an idea of the demographics of the survey responders, which you guys will see when you take this survey. And again, I encourage all of you to do so, because we need to be able to customize this curriculum based on the needs of a particular demographic, and they may need to be altered accordingly. So just to let you know, one of the questions was, what was the job position of the responder? And we got a wide variety of respondees, including treatment coaches, social workers, treatment centers, directors and presidents, physicians, educators, and those involved in community outreach. We asked what kind of organization you represent, and these included academic, community-based, and many not-for-profit centers, which is really important to know. And then again, we wanted to know what were the populations that were being served by the various treatment organizations, and they include general populations with substance use disorders and opioid use disorders, those that had comorbidity with mental illness, the homeless, the criminal justice system, as well as several racial minorities. So you can see the challenge is going to be to develop a curriculum that's going to match the needs of these different demographics. So that kind of data are really important. Then to summarize quickly what you already have seen with Vanna's overview, what I did is I combined the high to moderate need responding to get an idea in a rank order of the topics we need to focus on first by combining these two. And what you can see is that scientifically validated recovery programs, diversity-related prevention, treatment, and recovery, and engaging the family or significant others were the top three in terms of what the health professional responders felt they needed more education in. The next three were the scientifically validated treatment protocols, neuroscience of addiction, and the pharmacology of the various opioids were in the low 80% combined high to moderate need for training. And I noted here in parentheses, these three also had the highest portion of high training need, 42, 44, and 40%. So this would suggest that these top 6 topics are clearly an important area for us to focus on, maybe for our initial launching of an educational program. And this is an important bit of information to know. So then just quickly in conclusion, what I think this tells us, because the other topics that Vanna went over did not really cluster in any particular area, there was a lot of different needs. And given the high consensus of the needs that we obtained from this survey, this suggests that we've really identified some very key topics that we need to focus a really excellent education curriculum that is scientifically based and empirically determined with great scientific rigor, that will help benefit a diversity of health professionals to treat a big diverse population as well. So then what we're going to do is we're sending out the survey for real now. This was our sort of beta test, which I think went really, really well, demonstrating both proof of concept and feasibility, which is important to us. We will take the data from the survey. We'll put together a similar kind of an overview like this, and then we're going to be able to hand over this information to the educators that will start developing this curriculum. And I think that's where the work group would enjoy some input from all of you to assign this group of people, as well as how this work might be supported. So Vaughn, I'll turn it back over to you.
Thank you. So by the way, the next fentanyl work group meeting is going to be September 8th. That's a Wednesday at 10 a.m. We'll get that information out. And thank you. And I know we're chomping at the end of this meeting, and I want to make sure that, and hopefully maybe, I don't know if anybody would be okay with, we ran over about 5 or 10 minutes, but I do want to get information about International Overdose Awareness Day. It's a big event we're going to have on the 31st. And so I want to bring in Sandra Harrison, who's been coordinating for us. And Sandra, you got going on speed dial here on this one.
You know, Lee, what's really absolutely amazing about International Overdose Awareness Day is that it's going to be represented by the folks on this call. And we went over before because the folks on this call are focused on harm reduction. So good afternoon, everyone. Thanks so much for allowing the moment, Lee, but I'm really excited to, one, say that I have been working with many of you to organize the activities for International Overdose Awareness Day. We're extremely excited about it. We had a PowerPoint, but we really don't need to get into it. It's very simple because International Overdose Day is an opportunity for us to do what we do. It's an opportunity for us to highlight our collective impact to end overdose. It's an opportunity for us to acknowledge those who have been lost and to overdose. And it's a time for us to act. And we're really excited to have you guys all participating as we're going to kick this thing off. You can kind of roll through the slides. Next slide, please.
And we'll share these. We'll share this after.
Yeah, absolutely. You know, the collaboration is what we've talked about here today, and it's what we'll see at the kickoff. We're talking about the outreach team and their work and what that looks like and what it means to be in that space. So we're all going to share the space with the kickoff that happens at Jackson and Pulaski at 11 o'clock on International Overdose Awareness Day. You know, you guys, we are the International Overdose Awareness Day. We are those resources. So please come out and join us. Next slide, please. And that's like, you know, so fabulously. I just want to thank Lee and B and Jonathan, all of you guys who have done your due diligence, and everyone on this call who sent us your clean and vectored logos to make sure that we're all well represented here. We're really excited about this day and the collaboration. Next slide. So you got to ask yourself, how can the task force help and or support your events? And the reality is, if you have not confirmed your attendance yet, please let me know. We want to make sure that we are sharing your event with other task force members. We want to make sure that we are helping you to promote your event between our entire network. And we want to make sure that you guys are all gonna kind of show up to support and share with our community things like Narcan training and how to understand and recognize symptoms and signs of overdose, and just making sure that we are informing our community, celebrating and highlighting overdose awareness on that day. Last slide is just an absolute thank you all for your work and for being here. And if there is anyone who still needs more details or information about International Overdose Day, our kickoff event, our partnership events, our finale events that we're partnering with Oak Park Task Force, just please do give me a call. My information is both on the screen and in the chat box.
Thank you. And could you go back to the number 4,
Yeah,
please?
absolutely.
So nuts and bolts, bring your own table.
Bring your
We'll
own
start setting up around 10 or 10:30. Let us know if you have not confirmed that you're going to be there. We need folks to bring food, snacks, hygiene kits. The more the merrier, because I think we're going to get a lot of people out there. And as Sandra said, if your organization's having some type of celebration, I know that Oak Park is, and not just celebration, but honoring. I know CRCC is going to have one. Chicago Recovery Alliance is having their annual piece. And so, because we want to be able to get a blast
those.
out with all the
Yeah.
different ones, so people in different neighborhoods and time frames, et cetera, can attend and be aware of it. I know Live for Lolly's doing something. I know even up in Lake County, they're doing things. So we want this to be viral as much as we
Yeah,
can.
it's been amazing. And the important part of this work has been that we are starting to collaborate, from the Southside Task Force to the Oak Park Task Force. Folks are starting to think about this day and expanding the reach as we all work together to end overdose. So again, if you have additional questions, comments, or concerns, or if you're just trying to get your event off the ground or trying to figure out how we can promote or share it on our social media platforms or through our email blast, please, please, please let me know how I can help. I stand ready to serve.
Okay, well, thank you. And everybody, we're getting close to the end here. I don't want to be that hasty, but if any organizations or any groups want to do an announcement in our next minute or two, please raise your hand or just shout it out, or put it in the chat, and we'll make sure we get this chat out to everybody. Private conversations will not be included.
Quick shout, Lee, I have a shout out I would like to provide. Just so everyone know, there is medication that is free to individuals who do not have insurance or cannot afford to pay for their prescriptions of Suboxone, and it's at our community pharmacy called Regi Pharmacy, located in the 4909 West Division building. So
Great.
any individual.
Will you spell that in the chat as well?
I'll put it in the chat as well, but I do know that there's available thousands of doses, just that individuals who need it can.
Awesome.
Fantastic. Thanks for adding that. Appreciate it.
I think it's important that we also make it clear that, you know, of course, overdoses may take place, but they don't have to be fatal.
They don't have to be fatal.
And that's the work that's being done by Lou and his team and the entire task force out there, all of the people getting the Narcan out. And that's one thing that we have to make sure that we raise awareness on that day, that there may be overdoses, but they don't have to be fatal. And if everyone is trained and have Narcan, we could prevent preventable deaths from happening.
Right. You know, I just want to add that when we're training folks and we're handing them Narcan, this is an opportunity to really, it's actually a vehicle for us to begin to establish a relationship. Taking the time to answer questions, taking the time to get to know the story of other people. So we don't want to just hand Narcan out without that conversation and that linkage. You may be the first person that's given them that kind of consideration in a long time, and it goes a long way. And I noticed that's one of the strong points of Gail and Roger and Alita and Keith and all the folks out there. And I hope I didn't leave somebody out. I probably did. Anyway, think about this as a real bridge to a long time relationship and a beginning of a recovery process for people, even if they don't start right then.
Absolutely.
So I'm going to leave this open a little bit so that people want to put in any comments or they haven't put your information in. Maybe we go back to an hour and a half, but I know we're going to be at the end of an hour and a half, just in the same situation that we are now. But, and if you do have topic or a focus that you feel is not being covered enough for the folks on the west side and what our issues are, we can have special call meetings, just like we did with the fentanyl work group. No reason why we can't. I think perhaps we need to do another outreach piece to really pull in folks and educate the people who have not been doing this with us, and also to continue to hone our skills and our communication within the folks that have been doing this with each other for a while. And I
Hi,
really
can
I
can
really
I
want to thank CDPH and for really stepping up in the city to really help support this, and Super, of course. I don't want to leave out Super because Director Jones is on the call. So
Right,
that's
right.
all.
Hi, can I interrupt for 2 seconds?
Sure.
This is Julie Montgomery. I'm the Community Outreach for Family Guidance Center. I just wanted to announce my presence at the event.
Great.
If I can present a table.
That's
there.
fantastic. It's fantastic. We'll get with you. Did you put your information, Julie?
I did.
Okay.
I've been on the call and I did put my information. I'm from Family Guidance Center.
Fantastic. Thank you so much. All right, everybody. All right, everybody.
Thank you, Lee. I
Call,
appreciate you.
send letters, emails, texts. Have a great one, and thank you so much for all this great work you're doing. We're really making a difference out there, all of us. Appreciate it.
Thank you. Thank you.
Thank you.
Thank you.
I will stay on.
All right, Lee, the chat is saved. I can sift through there and get the personal stuff out later on so that we can have appropriate follow-up. And I can start recording now if you want or not.
Yeah, you can stop.
All right.